Bismillahirrahmanirrahim. Good morning, everyone. I am Dr. Alishba Rasool, and today I will be presenting medical education under the kind supervision of Professor Dr. Saira Afzal. Learning outlines, curriculum, development of a curriculum, types of curriculum, medical education, SPICE model versus traditional model, medical education in Pakistan, recent advances and MCQs. Learning outcomes. Learners will gain insight into curriculum development, including the process, phases, and various types of curricula utilized in medical training. Comparing the traditional and SPICE models, students will evaluate the relevance in medical education, identifying the strengths and limitations of each. Delving into the context of medical education in Pakistan, students will explore the structure, undergraduate programs, and recent advancements in this field. What is curriculum? A curriculum refers to the structured set of intended learning outcomes, educational experiences, content, material, and assessments designed to guide and support learning in a specific academic program, course, or educational system. It encompasses the overall plan and framework for what students are expected to learn, how it will be taught, and how learning outcomes will be assessed. Curricula can vary widely based on educational levels, subjects, and institutional or regional requirements. They generally outline the sequence of topics, the methods of instruction, and the resources used to facilitate learning within a particular educational context. Steps of designing a curriculum. Designing a curriculum involves several essential steps to ensure that it aligns with the educational objectives, addresses the needs of the learners, and provide a coherent structure for teaching and learning. Identify educational goals and objectives, conduct needs assessment, curriculum planning, content selection, instructional design, assessment and evaluation, implementation, evaluation and revision, continuous improvement. Curriculum design key principles. One is balanced, promotes intellectual, moral, spiritual, aesthetic, creative, emotional, and physical development as equally important. Rigorous seeks to develop interdisciplinary habits of mind. The subject matter is taught in a way that is faithful to its discipline. Coherent makes explicit connection and links between different subjects, experiences encountered. Vertically integrated focuses on progression by carefully sequencing knowledge, provides clarity about what getting better at what subject. Appropriate looks to avoid making unreasonable demands by matching the level of challenge to a pupil's current level of maturity. Focused seeks to keep the curriculum manageable by teaching the most important knowledge. Relevant seeks to connect the valued outcomes of a curriculum to pupils being taught. A curriculum breathes life into a school's or teacher's philosophy of education. It is purpose enacted. Different philosophies of educational personal empowerment, cultural transmission, preparation for work, or preparation for citizenship place different emphasis on aspects of curriculum design. Curriculum development process is a systematic process that involves designing, creating, implementing, and evaluating an educational curriculum. This process aims to meet the learning needs of students, align with the educational goals, and continuously improve based on feedback and changes in educational trends. Here's an overview of the curriculum development process. Needs assessment and analysis, setting objectives and goals, curriculum design and planning, content selection and organizing, instructional methodologies and strategies, assessment and evaluation planning, implementation and rollout, monitoring and evaluation, revision and improvement, documentation and communication. Curriculum development process, development, implementation, evaluation and launch, analyze and research and design. Steps of Kern's model for curriculum development. Kern's model offers a systematic approach to curriculum development, providing a structured framework to design, implement, and continuously improve educational programs. Number one is the identifying of the objectives, selecting learning experiences, organizing the learning experiences, evaluating, implementing, and revising. Types of curriculum: subject-centered curriculum, learner-centered curriculum, activity-based curriculum, interdisciplinary or integrated curriculum, core curriculum, hidden curriculum, spiral curriculum, democratic curriculum, problem-based curriculum, and transdisciplinary curriculum. One, subject-centered curriculum. Curricula organize learning around specific subjects or disciplines such as mathematics, science, history, or language arts. The focus is on mastering the content within these subjects. Learner-centered curriculum prioritize the individual student's needs, interest, and learning style. This approach focuses on the student's engagement and their active involvement in the learning process. Activity-based curriculum. Curricula emphasize learning through activities, projects, and hands-on experiences. It aims to engage students by providing practical applications of the knowledge. This is subject-based curriculum, as you can see in the figure. It's textbook syllabus-dependent, learner-based curriculum, and then activity-based curriculum. Interdisciplinary and integrated curriculum combine multiple subjects or disciplines into a unified learning experience. This approach shows how different areas of study relate to each other in a real world. Core curriculum include a set of common subjects or courses that all students are required to take regardless of their major or field of study. It ensures a broad-based education. Hidden curriculum refers to the unintended lessons or values that students learn through the school environment, culture, and social interaction. It includes social norms, behaviors, and attitudes implicitly conveyed within the educational setting. Spiral curriculum. Curricula introduce topics at a basic level and revisit them, gradually increasing the complexity and depth over time. It revisits topics at various stages of education, deepening understanding with each encounter. Democratic curricula focuses on fostering critical thinking, social responsibility, and active citizenship. It aims to create informed and engaged citizens within a democratic society. Problem-based curricula use real-world problems as the starting point for learning. Students work on complex problems, allowing for the integration of different subjects and encouraging critical thinking and problem-solving skills. Transdisciplinary curriculum go beyond interdisciplinary approaches by integrating various disciplines into a holistic and unified framework. This type of curriculum aims to address complex real-world issues without the constraints of traditional subject boundaries. Medical education. What is medical education? It's the process through which individuals, typically aspiring doctors and healthcare professionals, acquire the knowledge, skills, and competencies necessary to practice the medicine. It encompasses the formal training and learning experiences required for individuals to become physicians, surgeons, nurses, pharmacists, and other healthcare professionals. Components of the medical education: undergraduate medical education, preclinical clinical training, residency and specialty training, continuing medical education, professional development and continuing education, research and publication opportunities, licensing, examinations and certification, clinical rotation and clerkships, clinical experience and internship, clinical six, and stimulation training. SPICE model, in the context of educational strategy, is a framework used to design and develop effective educational strategies, especially in the field of medical education. Each letter in the acronym represents a key element to consider when devising educational strategies. Student-centered learning. From P, it's problem-based learning. I is for integration. C is for community-oriented learning. E is for electives and enrichment. And S is for systematic approaches to teaching. SPICE versus traditional curriculum. Now, SPICE is student-centered, while the traditional is teacher-centered. It is problem-based, the other is information gathering. The SPICE model is integrated, and the traditional is discipline-based. The SPICE is community-based, the traditional is hospital-based. Electives and the traditional include standard program. Systematic and the traditional is apprehension-based opportunistic. Medical education system in Pakistan. Structure of medical education: undergraduate medical education, postgraduate medical education, professional development and continuing education, and medical regulatory bodies. Undergraduate medical education: Bachelor of Medicine, Bachelor of Surgery, MBBS, a 5-year undergraduate program providing comprehensive medical training. Covers basic sciences, clinical medicine, and practical training through clinical rotations in various specialties offered in both public and private medical colleges across Pakistan. Bachelor of Dental Surgery, BDS, focuses on dental sciences and oral health, generally a 5-year undergrad program. Bachelor of Nursing provides education and training in nursing, patient care, and healthcare services. Doctor of Pharmacy, PharmD, a 5-year undergraduate program in pharmacy, covering the pharmaceutical sciences, clinical pharmacy, and healthcare. Doctor of Physiotherapy, DPT, trains students in physical therapy and rehabilitation. Postgraduate medical education, residency programs. After completion of MBBS degree, doctor pursue the residency programs in various medical specialty. Residencies generally last several years and involve in-depth training and practical experience in a specific field of medicine. Fellowship programs, subspecialty training following residency for further specialization in a particular area of medicine. Professional development and continuing medical education, ongoing education, and skill development for practicing physicians and healthcare professionals. Keep professionals updated with the latest advancements in the medical science and healthcare practices. Clinical practice and licensure. Upon completion of their education and training, medical professionals obtain licenses from the Pakistan Medical Commission to practice the medicine. Medical regulatory bodies. Pakistan Medical and Dental Commission oversees medical education, sets standards, accredits the medical colleges, and regulates the medical practices in Pakistan. The structured educational pathway in medical education in Pakistan provides a comprehensive foundation for future healthcare professionals from their initial undergraduate studies to specialized training and continuous professional development. Medical schools and institutions. Public Medical College. Pakistan has numerous government-funded medical colleges. Some well-known institutes include King Edward Medical University, Rawalpindi Medical University, Dow University of Health Sciences. Private medical colleges. In addition to public institutes, there are private medical colleges such as Shalamar Medical and Dental College, Lahore Medical and Dental College, and others. These institutions offer MBBS programs and contribute to the healthcare workforce. Challenges and reforms. Quality of education. Ensuring the uniform quality across the institutions remain a challenge. There have been concerns regarding the standard of education, availability of resources, and discrepancies in training among various medical colleges. Accreditation and oversight. Regulatory bodies like Pakistan Medical and Dental Council, now replaced by the Pakistan Medical Commission, oversees the medical education and have faced challenges ensuring standardized curricula, proper facilities, and faculty qualifications. Clinical training and infrastructure. Access to the quality clinical training and facilities varies across institutions, leading to disparities in the practical exposure students receive. Faculty development. Developing and retaining qualified faculty members is crucial. Efforts have been made to enhance the teaching standards and promote the faculty development programs. Recent changes and initiative. Curriculum reform. Some institutions have introduced modern teaching methodologies, integrated curricula, and early clinical exposure to improve the educational experiences. PMDC recommendations. It aims to ensure standardized and improved medical education and practice in the country. Quality assurance. There's a growing emphasis on enhancing quality assurance mechanism, accreditation processes, and continuous monitoring of the medical education standards. Research and innovation. Efforts are being made to encourage research and innovation in the field of medicine, aiming to advance healthcare practices and technology within Pakistan. Conclusion. Medical education in Pakistan is evolving, aiming to meet global standards and address the diverse healthcare needs of the population. Initiatives for curriculum reforms, faculty development, quality assurance, and technological integration are pivotal in shaping a more robust and standardized medical education system in the country. Ongoing improvements in infrastructure, teaching methodologies, and regulatory frameworks are vital for producing competent and compassionate healthcare professionals capable of meeting the nation's healthcare challenges. Now it's time for the recent advances. Artificial intelligence for healthcare and medical education, a systematic review. Human society has entered the age of artificial intelligence. Medical practice and medical education are undergoing profound changes. Artificial intelligence is now applied in many industries, particularly in healthcare and medical education, where it deeply intersects. The purpose of this paper is to overview the current situation and problems of AI medicine education and to provide our own perspective on the current predicament. We searched the PubMed, Embase, Cochrane, and databases to assess the literature on AI medical education from 2017 to 2020 July. The main inclusion criteria include literature describing the current situation or predicament of the AI medical education. Studies have shown that current application of AI in medical education is focused on clinical specialty training and continuing education, with the main application areas being radiology, diagnostics, surgery, cardiology, and dentistry. The main role is to assist physicians to improve their efficiency and accuracy. In addition, the field of combining AI with medicine is steadily expanding, and the most recent need is for policymaker, experts in the medical field, AI and education, and experts in other fields to come together to reach consensus on ethical issues and develop regulatory standards. Our study also found that most medical students are positive about adding AI-related courses to the existing medical curriculum. Finally, the quality of research on AI medical education is poor. In the context of the COVID-19 pandemic, our study provides an innovative, systematic review of the latest AI medical curriculum. Since AI medicine curriculum is not yet regulated, they have made some suggestions. Challenges towards quality assurance of basic medical education in Pakistan. There are growing concerns towards the quality of medical education in Pakistan. To help strengthen accreditation process, this study identifies the challenges toward quality assurance of basic medical education in Pakistan. The data identified 14 sub-themes grouped under 3 major themes. Challenges towards quality assurance included mounting political influence, commercialism in medical education, weak regulatory capacity of accrediting body, violation of rules, lack of valid accreditation standards, and skilled inspectors. Quality assurance of basic medical education in Pakistan involves various systemic, resource, and personal related challenges. The accrediting body needs to bring major reforms in its accreditation system and strengthen its regulatory and technical educational capacity to ensure the quality of medical education in nearly 168 medical and dental colleges in the country. Now it's time for our MCQ session. In the context of curriculum development, which steps involve continuous review and improvement based on assessment data, teacher feedback, and evolving educational trends? A, needs assessment, B, implementing, C, evaluating, D, selecting learning experiences, or is it D, revising? Anyone like to answer?
D, revising.
To correct answer, a medical college introduced an educational approach focuses on engaging students in hands-on learning experience and real-world problem-solving activities. Which type of curriculum does this new approach represent? Options: learner-centered curriculum, subject-centered, activity-based, core curriculum, or is it D, E, interdisciplinary curriculum?
C. B.
B, the right answer. In a medical school environment, students learn ethical behavior, communication skills, and professional conduct through observing their mentors and interacting with colleagues. What aspect of the educational environment does this represent? A, subject-centered learning, B, formal curriculum structure, C, hidden curriculum elements, D, structured clinical training, or is it E, problem-based learning?
E, problem-based learning.
A is the right answer. What is the primary focus of the SPICE model in the medical education for guiding learners through clinical cases and problem solving? A, enhancing traditional lecture-based learning. B, focuses on individual discipline mastery. C, encouraging the interdisciplinary interactions. D, structuring hidden curriculum experiences. E, facilitating the structured problem-based approaches.
E.
Yes, it's the right.
B.
In a conventional medical curriculum, students primarily engage in lecture-based learning, memorizing facts and attending the theoretical classes. What curriculum type best characterizes this approach? Learner-centered, B, activity-based, C, subject-centered, D, interdisciplinary, or is it E, problem-based?
C.
Yes, it's C. During clinical rotations, medical students encountered a patient exhibiting symptoms of fever, cough, and shortness of breath. Which SPICE model component involves identifying the problem exhibited by the patient? A, situation, B, problem, C, implication, D, choice, or E, evaluation?
B, problem.
Yes, it's
B.
As part of a curriculum development team, you are tasked with reviewing the existing educational program for medical students. Which phase of curriculum development involves analyzing the current educational goals and learning objectives? A, assessment, B, plan, C, implement, D, evaluate, or is it E, design?
B.
Yes, it's the right answer. A medical college introduces an educational approach that emphasizes a problem-solving orientation, integrating clinical cases into the learning process. Which curriculum type aligns with this approach? A, subject-centered, B, learner-centered, C, activity-centered, D, interdisciplinary, or is it E, problem-based?
E.
E.
Is E. A group of medical graduates are seeking further specialization in a particular medical field after completing their MBBS. What phase of their medical education is this? A, undergraduate medical education. B, clinical rotation and clerkship. C, residency programs. D, continuing medical education, or is it E, postgraduate fellowship program?
C.
E.
It's C, residency program. In Pakistan, which regulatory body is responsible for overseeing the medical education, setting standards, accrediting the medical colleges, and regulating the medical practices? A, Pakistan Medical and Dental Council, Higher Education Commission, World Health Organization, Pakistan Medical Commission, Medical and Dental College Admission Test.
A.
A.
Yes, it's the right answer. This is the key of the MCQs. Thank you, everyone. Please like and share to our YouTube channel.
Thank you very much, Dr. Alishba. Very nice presentation. And the best part is that you have shown the recent advances. However, I have few questions regarding MCQs. Would you please go to your MCQ number 2?
Yes, madam.
Would you please like to explain why you have first said that the particular answer is correct while the others cannot be chosen as the correct option?
A medical college introduces an educational approach focuses on engaging students in hands-on learning experiences and real-world problem-solving activities. So this is the activity-based curriculum C.
Why it can't be learner-centered curriculum?
Because we have included hands-on learning experiences. It's not just teaching verbally.
It can be interdisciplinary curriculum too. It can be learner-based curriculum.
Madam, when we use only hand-based, hands-on learning experience, the definition was of activity-based curriculum.
Actually, the hands-on training or practicals can be the part of any curriculum. It can be the part of the subject-centered curriculum. It can be the part of the core curriculum. Hands-on means that so there is something that is practically being done, or it is in the form of experiments, practicals, research presentations. All these are hands-on.
Okay, madam, I will correct this MCQ.
Okay, please go to your MCQ number 3.
In a medical school environment, students learn ethical behavior, communication skills, and professional conduct through observing their mentors and interacting with colleagues. What aspect of educational environment does this represent? A, subject-centered learning, B, formal curriculum structure, C, hidden curriculum elements, D, structured clinical training, or is it E, problem-based learning?
Again, there are more than one correct answers.
Yes, madam, I will correct this one.
And you have said that the hidden curriculum, C?
No, madam, I have told the problem-based learning.
It is not problem-based at all. It can be the hidden curriculum, it can be informal curriculum, or it can be the structured clinical training. In structured clinical training, all the things are present. Ethical behavior, communication skills, professional conduct, observing the mentors, everything is present. And it can be the part of formal curriculum too.
Okay, madam, I'll correct this one also.
Okay, if you please go to your MCQ number 8.
Yes, madam. Yes, madam.
Would
Madam,
you please
Medical
like?
College introduced an educational approach that emphasizes a problem-solving orientation, integrating clinical cases into learning process. Which curriculum type aligns with this approach? A, subject-centered, B, learner, C, activity, D, interdisciplinary, and E, problem-based. I told that it's E, problem-based.
Where you have shown it in your presentation?
Madam, this picture and the problem-based curricula use real-world problems as the starting point for learning. Students work on complex problems, allowing for the integration of different subjects, encouraging critical thinking and problem-solving skills.
Okay, thank you. Overall, it is a very good presentation, Dr. Lishma, and I am sure that everyone has learned a lot in this presentation. However, there are a few confusions in MCQs, so I hope that the answer that matches the scenario very well, and the eighth scenario, that is again not pointing out towards the problem-based learning, it should be rephrased so that it is more accurately reflecting the problem-based learning. So overall, it is a very good presentation. Keep it up, and Allah Hafiz.
Allah Hafiz, madam. I'll correct the mistakes and then upload.
Thank you. Allah Hafiz.
Allah Hafiz.